Hello, everyone. My name is Gabriel Ellis. I'm a psychotherapist and a Buddhist scholar, and this is the Curious Mind podcast. And on this podcast, I try to dissect with my guests complex psychological topics, and sometimes I reflect on self-development and meditation as well. My guest today is Ulrich Koch. Ulrich Koch is Assistant Professor of Clinical Research and Leadership at the George Washington University School of Medicine and Health Sciences in Washington, D.C. He's a psychologist as well as a historian and philosopher of the medical sciences and has several publications, among others, on trauma. And, for example, his book, published in 2014, titled in German Schockeffekte, eine historische Epistemologie des Traumas, which would translate in English as Shock Effects, a Historical Epistemology of Trauma. Welcome, Uli.
Well, thank you for having me.
So we have briefly discussed that you have spent some years with the trauma topic, and you're quite fortunate to have this double perspective as a historian and psychologist on this. So I'm quite glad to discuss such a complex topic as trauma with you. Naturally, we'll not get to discuss it fully, which would take hours, I guess, with your experience, but at least to touch upon some important topics, and it is a highly relevant topic today. To start with, why don't you give us a short historical overview about the concept and understanding of trauma, starting with the 19th century, where it became quite relevant?
Sure, I'm happy to do that. I think a thumbnail sketch sort of the history of psychological trauma, like you said, starts in the 19th century, in the 1860s particularly. Most historians have traced it back to the 1860s with a ailment that was called at the time railway spine. So it was railway accidents that led some passengers to show symptoms, a diverse range of symptoms. One should add mostly of them somatic symptoms and bodily symptoms after railway accidents, without there being an obvious lesion or a damage of the body. And I mean, this is significant, right? And already this first episode, where sort of something emerges that would later morph into the medical discourse and the psychological discourse of post-traumatic suffering, is in the context of changes in law, and that let individuals who suffer from such accidents make claims for compensations because they've suffer from these accidents.
And that was already at that early time?
Yes, that is what prompted the first writings on railway spine, and which later became railway brain, and then soon became the accident neurosis or traumatic neurosis, and it sort of morphed into something ever more psychological.
I see.
Both in terms of its causes, but also in terms of the consequences it had. So this is the first sort of stage, the first act of trauma appearing on the historical stage, or something like, I mean, what I mean by that is, of course, is not trauma as such, or the experience of violence as such, of course, but as something that is studied, or that raises the concern of the medical and in the broader sense, the health professions. And there's one could say, three episodes where trauma becomes really, to give you just a quick overview historically. So this one is the accidents of the second industrial revolution. Then we have the Great War, the First World War, where shell shock becomes a very prominent topic, of course, also in England, but also traumatic neurosis or hysteria in Germany, traumatische Hysterie, Kriegsneurose, war neurosis, but in all war-waging nations at the time. And then this continues into the Second World War. And then, of course, the last sort of the more recent episode is war, the Vietnam War, where this becomes a salient topic, and to sort of again a continuation of the legal context that was always important is maybe in the 1980s and 90s discussions about false memory and the traumatic effects of sexual abuse, and which again already channeled again a lot of interest from the profession, but also from the public. So yes. I think this so the war context and the legal context, there have been forces, and hence a lot of historians have stated there's a waxing and waning of interest in trauma over time. So it brings contingency into history in a way, right. Because once in the post-war years, historians have long I've argued there's diminished interest, and it shoots up again in the 1970s. So that's sort of the long, like a very rough sketch of those of how trauma became at least a topic in the medical and psychological sciences.
Yes, and we will come to talk about this more, but today, again, we have maybe for the last decade or so, I think we live in a time where there's, again, a lot of public interest in the topic of trauma and an expansion of what psychological trauma means to people and how they understand it. Mm-hmm. Now, one important aspect that I also read in one of your publications on trauma that was connected with the concept of psychological trauma was disruption and discontinuation. Mm-hmm. Can you expand a little bit about that? How did that come about? And what is the place of these kinds of ideas of the disruption of experience, the disruption of life? What does it have to do with the understanding of trauma?
Right. I think when I thought about how trauma, and this is I think this really gets into sort of one of the more, I would say, philosophical questions around this. Uh-huh. I wouldn't say necessarily that experts on trauma or trauma therapists explicitly thought of trauma in terms of disruption, but very much the way it was seen, or the way I think the implicit assumption that accompanies a lot of the sort of the treatment of trauma was that it was a discontinuation of experience, that's something that stands outside normal everyday experience. I think in the DSM, in the Diagnostic and Statistical Manual of Mental Disorders, right in the first edition of the DSM, that mentioned PTSD, that was in 1980. The definition, and this is there is a so-called trauma criterion, right? Yes. And it was sort of stands outside normal experience. So it's an abnormal experience that trauma constitutes. That was one of the basic tenets.
Yes, so just to interrupt you a little bit, so the DSM is one of the major classifications for diagnosis. So in 1980, professionals could for the first time give officially the diagnosis of PTSD, even though it was discussed, traumatic responses were discussed already for a longer time, but this is the time when it arrived at the mainstream of the psychological and medical community, and it was officially recognized as such. So people with these kinds of symptoms then could get the diagnosis of PTSD. And as you mentioned, at that time, there was one of the criteria is that the events that took place, and correct me if I'm wrong, should have been something excessive, out of the normal, where the experience was a discontinuation, for the lack of a better word, where the normal life ended for whatever reason, be it an accident, be it a war situation, be it a violent sort of abuse, sexual or otherwise. And that constituted one part of the idea at the time of how the traumatic response came about. Is that more or less correct?
Yeah, no, that's great. That's a great paraphrase. Great way to put it. But I think it's this idea that trauma is not something that belongs to everyday life patterns. It can't be expected. It can't be anticipated. It gets you when your defenses are down. Right? It's not something, and that leaves these scars. And but the idea, that it's accompanied by great fear. That has always been around for a long time. The question was always, what does trauma act as a trigger, or is it the actual cause of an ailment, of a complaint, of a psychological disorder? And prior to the PTSD diagnosis in the DSM, it was more often seen as a trigger. But there's something in the personality that lets a trauma act as a trigger to bring a pathology to the fore, like make something, let this person fall psychologically ill. But it's not, the trauma itself is not that relevant when it comes to having a causal explanation of that ailment or that complaint.
Does that mean that the understanding was that not events are traumatic, but only the combination of an event and a susceptible individual cause the trauma response? Is that correct?
Right. And even though, I mean, you can find, even though at the time, I mean, and I think in the chapter you mentioned before, there's some influential books about the stress of war already in the 1940s. So in the wake of the Second World War, the idea that normal people, quote unquote, could suffer trauma was also taken for granted. But the question was, okay, when does it become a chronic problem? And there, clinicians would say, no, it's something that only with a certain predisposition will it become a chronic problem. But there are acute stress reactions or reactions to trauma that are pathological. But it's not. These are just transient.
Right. So maybe it's good at this point to, for the people who are not quite aware of this and don't have access to the DSM, to recount what medically is perceived, or for the therapeutic medical establishment, what is necessary in order to diagnose today a post-traumatic stress disorder, PTSD diagnosis. So this is not historical. This is from today. It's the DSM-5 edition, and what needs to be there in combination is quite strong. We need to see quite strong limitations or sufferings in the individual in order to be able to give this diagnosis. So this is not, an easy thing to do, that because I feel somehow distressed or because I have a burnout, for example, that this could be misdiagnosed as a PTSD. So the most important element at the beginning is that there needs to be an exposure to an actual or threatened death situation or a serious injury or sexual violence. This can be a situation that was threatening to me, or I can also be traumatized by witnessing how someone else was in a dangerous situation or died, and so on. So which explains how ambulance drivers, for example, or survivors of war who just witnessed how their comrades have fallen and so on, they can equally be traumatized. So the exposure to such an event in some way is necessary as a criterion. And then we need other criteria as well, something like distressing intrusions. Intrusion is an experience that jumps into my mind out of the blue, basically, and has little to do with my inclinations or with what I want to think about. And it's persistent in that I cannot just make it go away. This can be a memory that comes up. It can be a memory in daytime. It can be a memory in dreams. It can be flashbacks where I re-experience entire episodes of the traumatic event that I encountered. So those kinds of intrusions are quite characteristic. Don't always have to be there, but they're quite characteristic. And because they usually create such a distressing emotional reaction, a normal response of people is that they try to avoid situations which trigger such memories or such intrusions in their mind. So there's the characteristic of the avoidance. And then in general, there need to be distressing experiences, feelings, thoughts, negative beliefs about oneself, a general heightened experience of fear, and distress. So a whole kind of range of negative experiences for an extended period of time.
Right.
So all in all, we can see that it is a severe syndrome, and people who kind of carefully diagnose this would not mistake someone who has depressive episodes and questioning if if their life has purpose and so on, would usually not mistake that with a PTSD. And this becomes relevant when when we talk more about the current situation today and how the idea of what trauma, psychological trauma is, has significantly proliferated among parts of the lay community and how they understand it. How do you perceive kind of the development from those 1980s, let's say, to more this millennia? So in the past 20 years, what have you observed as changes in the understanding and awareness of psychological trauma?
Yeah, I think what you're getting at is really important in the sense that trauma became this very expansive category.
Right.
But I think there's some authors who have suggested that there's a conceptual bracket creep. That's what they have called with regard to DSM. Also, that more and more events could be classified as traumatic, and I think more recent editions, right, have tried to remedy that in response. But I think I can see how that question is really relevant for psychotherapists and psychologists, but also for the general public, because we connect moral claims, right?
Exactly. Yes.
To the trauma, and we say you have access to a privileged position that is epistemologically privileged because you're a victim, but that's also morally privileged because you're a victim.
Can you explain the epistemological part?
I think this has very concrete applications in literary theory, right? Where the traumatized, like in some of these readings of how trauma manifests in literature, is that there's some kind of privileged access to reality. I mean, I don't want to go into that, but there's, yes. and I think there's also a common notion among us that a true history, one that is not distorted by interests, is written by those who are victims, right? And this is, of course, also connected to a topic that also looms large, of course, in trauma studies in the humanities, which is the remembrance of the Holocaust and the Shoah. So it is this these attempts to make history disappear, which happened after the Second World War, right? In post-war Europe, and that trauma was a vehicle to rehabilitate or to address this, right? To redress this and let voices come to the fore that haven't been heard, and have a more direct confrontation with the violent past. And I think that trauma played a role in that. And I think for all these different reasons that overlap, or strands that overlap, trauma has become also this epistemologically privileged position, or like the traumatized as this privileged position is something from the viewpoint of a survivor, from the viewpoint of somebody who's a victim. Things appear different and arguably more clear, right? To put it in simple terms. But I think that's sort of the idea behind it.
So what I get from that is that it shows that there are different levels to the topic. On the one level, we have the individual who has experienced something traumatic and suffers from that and seeks the recognition, seeks help, goes to therapy, wants to overcome that for their own personal sake in order to get along well with their life, which is the job of psychotherapy. And then there is a level where I understand that society had to come to term with a structural aspect of trauma. For example, when war happens, where it has to come to terms with itself. What are we as a society doing with people sending soldiers out to war zones? How do we understand ourselves in this position? For possible implications of how does that feed back into the peace movement? So not just as a general kind of idea that peace is nice and nobody should kill each other, but also we don't want to send our children anymore, we as a society, into war to see them again coming back traumatized. I mean, you're in the US, you have seen this with the Iraq War as a topic. I have relatives who have been in the US as soldiers in Iraq. And then it becomes a whole societal thing where it's the topic is discussed, what is justified as a traumatic event. How do we take people seriously who make a claim to be victims? These are quite difficult discussions that are kind of having had on the societal level. And especially, I think in the few past years, there have been shifts in kind of the recognition of what is legitimately can be perceived as trauma. And yes, I would like to hear your thoughts on that.
No. I think this is really, I think you're putting your finger on it, and that there's a collective dimension to this, that we're entering sort of the realm of values and sort of also assessing what sacrifices are justified or not, and who gets to have this status, and whom should we believe. So I think there's all these questions there, but I think these questions somehow are not answerable within trauma discourse, right? They need to go beyond them. And I think that's one of the points of criticisms that are frequently raised, is that if trauma stays within this sort of psychological realm, they cannot get to, they sort of obscure some of these larger questions that you just sort of raised, and you pointed to. Because it's not a moral discussion in principle, especially with the turn to trauma being perceived in terms of traumatic stress as something that has a predictable pattern in an individual that is affected by it, and where you don't need to look to the cause necessarily. If you identify that pattern in principle, the idea is, at least sort of an evidence-based practice in psychotherapy, that it's shared in some scientific communities. You would say, well, the question of whether this is a trauma or not becomes, in a way, secondary, right? Because they can say, well, let's just bracket that moral question and treat the PTSD. But there's, you need to pass that threshold, right? And then once you pass the threshold, you're a certified victim, so to speak. But this. I mean, I don't mean in any way pejorative or in a disparaging way. I think it's more, the acknowledgement is important, to put it positively, right? The acknowledgement is important.
Absolutely.
And psychotherapists have been thrust into that role of making they are the ones who acknowledge this wrongdoing that has happened, and that can be an isolating discourse, right? But it should involve, or like the goal is, of course, and psychotherapists have often tried that in the past, to connect it to broader societal topics and actually feed it back into society and not just stay within the consulting room.
Right.
So I think it's something, it's just a moral aspect I think you can't ignore with trauma. And then just to add, of course, in the DSM, the ways mental disorders are classified, it is PTSD is an oddity, that in the sense, to the extent that it introduces makes a causal claim about where the disorder comes from. No other other disorder in the DSM does that, except for the course that are sort of organic. But otherwise, there's no claim being made about what the etiology is of any of these disorders. But PTSD is different, and I think if you took that away, it wouldn't be anymore, right? So it's not, I think, this idea that you can just diagnose a syndrome or this collection of syndromes, and then once and that will lead you to a path of trauma that is mistaken, likely.
Yes. So,
but just to the other point, I think to the expansion of trauma, what hasn't changed, and I think I try to make that try to make that claim in various things that I've wrote, is trauma has always been an attractive concept. I don't believe that PTSD is something that catapulted it to it sort of certainly gave it more exposure, but I think that clinicians had been interested in trauma, and that this was an interesting model to think with. Also, in various fields, is the case, and that there's always been a struggle to define the lines. I mean, even if you look at the sort of at the earliest discussion about railway spine, you always had struggles of, okay, what is a quote unquote real disorder, and what is the fictitious, and what is sort of and I think that's sort of baked into it from the beginning.
Yes, and I would like to continue on that line of thought, because as you put it in one of your articles, the way of thinking that it doesn't have to be necessarily one major event that is traumatic, but that basically everyone is traumatized by our way of life, is in fact quite old. And that takes away exactly the element that you mentioned, the one causal external factor, where one of the kind of philosophers, Adorno, and probably also other people in that line, were commenting, as far as I remember, that the way of life that we have is traumatic. Nobody can be without traumatic scars, because we all have to overcome the difficult life condition that capitalism has imposed itself on us. And I find it interesting that this very proliferating, very vague kind of thinking about, not vague, but encompassing way of thinking about trauma has a resurgence today. And again, in a very broad sense of thinking that, yes, all of my hurts, all of my pains must go back to some trauma, to my parenting, to me being parented by my parents, to me grown up, neglected needs, my past relationships have traumatized me. That somehow resembles to me the way of thinking that this dramatic word, this label of trauma that you mentioned is so attractive to us, has become a little bit too attractive for our own sake, and is applied to so many everyday situations. How do you perceive, from a historical perspective, but also from your observations, such a broad application to the normal scarring, let's put it this way, that we all have?
Yeah, I think you're right to point out that this has a long history, and I do think that PTSD, the way it emerged, and the sort of that you're right about the resurgence that took place once it became this diagnostic category. But I also think, in part, doesn't explain it, but I think we also have to ask, okay, how come we tend to, I'm using the we now, I don't know how inclusive that we is, right? But I think when I think about trauma at the time when I studied psychology, and this is more personal anecdote, I guess, than it is a sort of sound historical argument. But I hope you let me indulge this. I think we've lost a bit of the language to discuss how our environment shapes us and our social environment shapes us in the social sciences. So there has been, I began studying psychology in the 2000s, and when at the time everybody spoke of the brain, right? and neuroscience and neuropsychology was the hype, and that's not so much the case anymore. There's a lot of long faces and disappointments, but I think trauma was always compatible with the biological sciences. So there was also a push towards integrating trauma, the study of trauma, with these other disciplines. And psychology also lost a bit its footing in the social sciences at the same time. So I think there's also there's a displacement in some extent in the way we think about how the social shapes our thinking, our experience, and trauma is sort of a leftover of that. It displaced and replaced some of the more richer discussions I think that happened in the post-war period and about how social conditions shape the experience of everyday people, or maybe also how they influence certain neuroses, and how the idea of a neurosis could become this point where anthropologists and sociologists and psychologists could sit together and think about what that meant. And I think this is not the case anymore. So trauma also feels like it is filling a gap, or that's what it felt like to me, because of the way psychology also became more of a science rooted in the biological sciences rather than in the interpretive traditions that make up other branches of the social sciences. So I think that's one part of it, I think.
Yes.
And then it became attractive for those reasons I think we've discussed.
What I find quite fascinating about it so again, when we look at today, we have a very fragmented discourse. Mm-hmm. We have obviously individuals who clearly belong to the core category of diagnosable kind of PTSD. We have a more kind of historically based understanding of the trauma discourse. Mm-hmm. And we have a generalized vibe of what people understand as trauma. Mm-hmm. What I find fascinating whenever we encounter such a fragmented discourse about topics, that it leaves the individual in a place of insecurity. Mm. And because this is what we do, right? I mean, it's a very complex topic, but we as individuals are always in fraction with a public discourse that we depend on in order to make sense of our own life. We need to use words. We need to use the kind of the vibes that are prevalent in society today in order to reflect about ourselves. Mm-hmm. Applied to the fragmented trauma discourse, on the one hand, I have people who, in a very nonchalant, by the way, say that they were traumatized by the previous relationship, mm-hmm. or that we just kind of, as a matter of fact, assume that it's correct when they say that they were traumatized by their childhood, mm-hmm. In a non-PTSD way, but in a more general way. And we have, for example, parents who are in a very serious way afraid that if they do something wrong, they will traumatize their children. Mm-hmm. Coming from a very general understanding that scarring is traumatizing, that making mistakes, that withholding things from your children, not giving them certain experiences, not giving them enough support, maybe not loving them enough, and so on, will have dramatic effects, because this is how the word reverberates, right? It has the idea of serious hurt, of injury, is embedded in the word. Mm-hmm. So the tension between kind of a generalized idea of trauma and this connotation that it still holds, which is a serious injury, infected certain people, I think, where they see themselves as traumatized, where they're afraid to traumatize other people, and where they don't know how to respond to this, because it brings you in the dilemma in a relationship with your children. Mm-hmm. You cannot just always be nice. The expressions of our needs to show the limitations of what is possible and not possible will inflict some sort of pain in the other person. Yeah. And it can be intimidating to feel that I might be responsible for trauma in that. Mm-hmm. how do you perceive this conflict of the individual who has to deal with the consequences of a proliferated trauma understanding and their own life situations and decisions that they have to make?
Right. I think one can, and these are lots of different questions, I feel, right? I think it's on the one hand, but I think what your way of framing it is really nice to say this is sort of a, I don't want to make this pun, but you could say they're traumatized by the ubiquity of trauma.
Yes.
Or like, if you traumatized, of course, in scare quotes in this sense, because I wouldn't use it in this sort of very flexible sense.
Yeah.
But I think what's important to ask for anybody who feels this, being overwhelmed by these, by that moral plea that comes with the claim of being traumatized, is to take a pragmatic perspective, but now in the everyday sense of like, let's find some middle ground and not put all the difficult questions aside, but in the philosophical sense, which is, what are people doing when they speak of trauma? Right, in that sense. And I think that some of the senses you mentioned, or some of the usages you mentioned, they point to very different things. I think that was one of the points I tried to make also in the essay that you mentioned earlier, is critical theorists like Adorno and Lyotard or Zizek or those authors, they use it for a specific purpose, and they have a specific, it's embedded within a philosophical theoretical project. They use it in one way. The clinicians who want to treat trauma victims use another way, and I think, or use it for other ends. And those who are using it in research, do clinical research, and want to use it for epidemiological studies, they might have a different understanding because they find a different notion of trauma useful for whatever it is that they're doing. Yeah. And I think it's the same. You can break this down to the interpersonal level, right? When people speak about being traumatized in relationships, I mean, you would have to look at the specifics, right, of that. Always come back, okay, what is this person trying to do here by labeling it as such? Is it, do they want to talk about it further? Do they not want to talk about it further? I had this experience once with a patient who I felt, and she was not but I was in this case discussion, I was involved, and she was living, I was working in a therapeutic community, and it was clear when this person mentioned their trauma, it was clear that she just didn't want to talk about whatever the therapist wanted to talk about. Right? So she, this is not to say that it was not a trauma, but it was also clear. And I think one has to take that seriously.
Yes.
And not just say this is an expansive view. So I think instead of getting bogged down in discussions over semantics, it's like getting back, okay, in what sense is trauma used here? Because it's clearly something else than if a researcher uses it or a therapist. So we have to come to grips with how we use it in everyday life. And I think that's just, I think looking at how it's used in other discourses is actually can be helpful for that. Right?
Yes.
So creating the contrast and realizing, but that's very different. The way Adorno uses this as this sort of vague metaphor than how this researcher uses this. And then you might go think about yourself, well, how am I using this? And what am I trying to do when I say, I don't want to traumatize my kids? And some of the questions you get at, right, there are questions that are fundamental questions about raising a child, or they're fundamental questions about how to cope with conflict in relationships. And maybe trauma is not the best vocabulary for solving some of these conflicts, right? I mean, that could, because it's sort of, there's always the danger of shutting down something.
Yes. It's an excellent point, not just for the clinical practice, but it really reflects, I think, on us consciously navigating the modern life and media life that we have today, including social media, where one key skill today and for the future is that we have to be quite careful with, or attentive to, the terms that are used. And to be attentive to what is the possible purpose of someone using certain vocabulary, loaded words especially, right? Because it implies agency, victimhood, a morally superior position, and so on, the things that you mentioned. And that we unfortunately live in a social media environment where instrumentalizing such terms is relatively common.
Mm-hmm.
And we are exposed to that. And because of being exposed to so many sources and interests who use those words in various ways,
Mm-hmm.
it's very important to have the skill to understand that I cannot just take it without digesting it. I cannot just. I have to chew what I'm consuming.
Yeah.
And it's not a secret that psychological talk, self-development talk, and so on is as broadly used as ever, I think, today. And those terms have kind of psychological implications.
Mm-hmm. Mm-hmm.
And connected with social media consumption and terms like trauma, I think it's good for people to ask themselves, what am I doing to myself when I'm applying a certain label to myself or someone that I'm directly in contact with?
Mm-hmm.
Does it strengthen me or does it weaken me? Am I looking for attention? Am I looking for support? Is this an expression of fear of doing something wrong? Or is it an honest search for circumstances that would seriously hurt people? And this is extremely complex. And surely we cannot decide those questions or say that it's exaggerated all the time. It points more and more, I think, to the responsible individual who cannot rely anymore that the sources where it's coming from are doing it responsibly, and where we have to kind of be careful of the diet of vocabulary that we apply to our lives.
Yeah, no, I think I'm all for being conscious the way you use words and being aware of their implications and connotations. But I think it would be wrong to say that there's a true, at least this is again the historian speaking, right? What is the essence of it, of what's the core of it, of being traumatized? And yes. I think that's problematic. I wouldn't go there. That some people or some authors have a better grasp of what it was actually meant to do, and what the problem, that they represent the traumatic more accurately than other uses of the term trauma. Right. I would be reluctant to say that, but I think you're right to look at it how we use the term and when it's applicable and when not, and is hard to also assess, I think, without taking the whole situation into account often, right? I think like the example I mentioned earlier, I think there's other ways it can be a good way for bringing up, especially in today's media ecology, right, to bringing up certain topics that maybe we should know about or care about. Trauma can be an important tool, or framing it is in terms of post-traumatic suffering or the effects of trauma. But there's always a flip side to this, right? There's always you gain something and you lose something, and then I think it's important to think about, okay, what do you lose when you frame it in this way? And I think it has shown for social movements, for instance, it can have a odd decontextualizing effect to frame things as trauma, because other things that you cannot point your finger at, like this is the effect of trauma, then don't enter public awareness, right? So you need the trauma, but what if you don't have it, but you still see that there's clearly something wrong that needs to be addressed, and maybe also that is damaging to people's and so I think these are very thorny questions. So I would just trust that. I think it's very hard, or maybe to sum up my point, I think it's hard to police the usage of a word. To say, this is applicable, this is not, because it's evolving. And I think maybe, who knows? One could think about the future of this, the way we use trauma, and could think, well, maybe in a couple of decades, that the moral connotation and the moral superiority, let's say, or let's maybe superiority is the wrong word, but the moral status that you gain by being a trauma victim, that could go away.
Yes.
Right? When it's so often used in these sort of diluted ways, it could very well disappear, and would have to think about something else. But yeah, I think it's not in anyone's hands.
No, it's not. It's society figuring it out for itself, right? Yes, and we witness that basically live as we kind of tap into those different discourses. My last question to you is more general, because you dealt, if I see it correctly, for a couple of years with the trauma topic in the past. When you kind of were done with the most parts and you started to move on to different topics, how do you look back on the topic? What has been major shifts in your understanding? What is your takeaway from an exposure to the complexity of the topic that most of us don't have, from this psychological historian perspective?
I think when I look sort of inside the academy, what historians are doing, what literary scholars are doing, so in the humanities, I think there's a shift away from trauma as a singular event, thinking about that in these terms. There's also much more critical readings of trauma. I think the field of trauma studies has moved in new directions. It's engaging much more closely with sort of the I would call it maybe the peri-traumatic, but what happens around trauma, what happens in these events, but how is it? What's the social context here of those who experiences it, of those who might be perpetrating it, of the social conditions that make it possible that these things happen. I think there's a opening, I think, towards these kinds of questions. And so I think that's in principle a good development.
Yes.
I think it's also being found less useful. I think so the whole notion of trauma as an analytic category that it maybe was in the 1990s and early 2000s, that's not so important anymore in the humanities. And I see now at least from a US perspective, there's a general shift again to social determinants of health, also mental health in medicine, but also in psychiatry and clinical psychology, to social conditions, structural conditions in a much broader sense, where trauma still plays a role, but it's clear that it's tending to become less ubiquitous, I think, and less important for these other types of analyses. So there's more a shift towards structural questions,
like stress causing events, for example, in general.
Not just events, but sort of housing conditions and
structural
working conditions,
yes,
and racism and all the isms, sexism and racism in particular, and how they affect mental health or family structures or food insecurity, or there's so many so many lines of research that are ongoing that look at the social conditions much more again. So I think the trauma hype that was, I think, again, to get back to the point I made earlier, that is somehow, it seems to me, connected to the decade of the brain and the biologization of parts of psychology and the scientification of parts of psychology. I think that is a little on the when it's the pendulum swinging back more towards looking at broader social conditions. So I see sort of how that might look different from everyday people, and that trauma has become such a ubiquitous term in everyday parlance.
Yes.
But I think for swaths of the medical sciences, the psychological sciences, but also in the humanities, I think we're a bit on the downturn.
Yes. I find that very interesting, this observation, and I have not made this connection yet. But yes, indeed, like you mentioned, I studied psychology a little bit earlier. I started in 1994, and already back then there was a big hype in neuropsychology.
Right. Yeah.
And that was this whole period of time, the mid-90s, basically going on today, where a good part of, I think, the scientific psychological community has retreated to the hard science, so to speak, of neurology and neuropsychology. And this is how I understand your argument. It kind of left a vacuum, left the field over
yes.
to more general authors, conceptualizers, to a more general discourse, and has retreated from those more vague elements of the public discourse around psychological terms, and that this has contributed to a quite different idea, a non-scientific idea, a non-hardcore diagnostic idea of trauma, and that this would be one of the forces that enable us to fluctuate so much with different connotations of the term. Is that correct, how I understood your point?
I think, yeah, if I understood you correctly, I think you are getting at it, but maybe another way of putting it for me, or sometimes the way I also think about it is, trauma was a good for the immediate post-psychoanalytic era. It was a good term because it had this connection to psychoanalysis, to Freudianism, to some ideas of how the environment shapes us, or how our desires shape us, and how our hurts and our negative experience shape us. But at the same time, it didn't really get into the whole, human as a conflicted being.
Yes.
It was more like something outside that impacts us, and that was also that can be easily integrated into scientific models that neatly divide up the world into, okay, that's what happens inside, and that's sort of the external factors that impact it. And I think it could align with that and was consistent with that, and that's why I think it filled this void in science, but at the same time, or maybe also in public discourse, where the whole model of conflict was no longer didn't strike people as particularly useful in many Western, industrialized nations, because we had to deal less with conflicts of authority, I would assume, but we were thinking more about our limits and about our struggle with them, and our limits that are also set to our narcissistic fantasies, maybe, right? So I think that's trauma really fits the bill there, right? To address some of these questions. Yeah.
Very interesting. I did not promise that we would solve all the problems around the concept of trauma and the history of trauma, but it was certainly for me a very interesting, detailed conversation, and I hope that the audience sees the many different aspects and facets of deconstructing and looking at such a complex phenomenon, and might be inspired to delve a little bit more into it. I will leave some links to your publications below, and I thank you very much for the conversation. Thank you, Uli.
Well, thank you, Gabriel.